I'm a sergeant for North Patrol Division Mental Evaluation Team, which encompasses Malibu, Santa Clarita, West Hollywood, Lancaster, and Palmdale. The MET team is a service that provides care to mental health patients during crisis calls for service. This happens to be Mental Health Awareness Month in May, and there's a big stigma around mental health. People will easily tell you that they have the flu or a cold, but they won't tell you that they have a mental health issue. Being mentally ill is not a crime, so we're trying to link them with appropriate care. As of right now, we have any given Sunday, our jail population manages between 16,300 and on the high 17,300, which is the largest jail system in the United States. 5,000 of those, that population I just cited, is mentally ill. So by default, we become the largest mental health institution. It's my opinion, and opinion of a lot of my colleagues and supervisors, that the jail is not the best place for people that are mentally ill. There needs to be treatment. So we work with programs in jail to, once they get released, JMIT programs, Jail Population Management Bureau, that they will be linked with services once they leave. The Sheriff's Department is aware that mental health calls for service are important. We're trying to show compassion. The deputy will get a call regarding somebody that's mentally ill, being violent, suicidal, and the MET team will get dispatched through the MET triage desk as a support function for patrol deputies. Okay, this person committed a crime. He has a drug addiction, this, that. Okay, let's try to do education-based incarceration. Let's try to teach him, develop him skills, get his GED, get him job skills, vocational skills. Oftentimes when you have uniformed personnel dealing with persons that are mentally ill, there may be a misunderstanding or a breakdown in communication, and it can rise to a level of force for officers that isn't, I don't want to say unwarranted if that was the officer's perception, but it could prevent that. It's my opinion that mental health is the future of policing, that you have to have an end-all. You can't just throw people in jail and throw away the key. So you got to have solutions. We have a lot of people that are mentally ill that are homeless. Homelessness is a nationwide issue. We happen to be a large county with dense population, so naturally it's going to affect us more. And we do provide outreach. We have a separate bureau a separate team rather, that's under our same bureau, which is CPB, Community Partnership Bureau, and they do outreach services to homeless persons. Now, when they do these outreach programs, when these teams go into the wash or they go behind the building where the person's living, they often will bring a MET team, and that's my teams, and they come in and they will assist them with linkage and different resources. There's a lot of different resources out there that the county provides, except a lot of people just wouldn't know how to get them. And let's talk about this. A lot of times you could offer somebody all the resources in the world, but they just won't consent to any services. So each case is its own individual circumstance, but we try to get as many as we can and help as many people as we can. Again, it's about the linkage, getting them off the drugs, providing them programs, services, hope.